and I actually trained in medical school and residency and fellowship at West Virginia University, and then joined Mon Health right out of fellowship, and been there ever since.
What got you into cardiology?
It was always actually kind of an interest. Once I kind of really knew that medicine was what I was going to do. My grandfather had coronary disease and actually passed away from that when I was about 5. He started having more trouble when he was about 5 and passed away when I was 10 or 11 from coronary disease. So I think that's kind of always was in the back of my mind, and so I think that kind of helped push that way. Interestingly enough, when I went to medical school, I thought I was going to end up doing orthopedics because I played sports in high school and was interested in that sort of stuff. But then when I did cardiology, I kind of fell in love with it, and that's where it kind of started.
Yeah, it's funny how things work out that way. You have a plan, you think you're headed down this path, and then something along the way happens. You go, I kind of like that too. Maybe I'll go that direction. And
yeah, it was kind of a lot more of a better fit. Plus, still, I liked the thought of doing procedural aspects and things that way, and but I also liked the actual medicine aspect of internal medicine and cardiology too. So you can kind of do both with cardiology.
So why did you end up at Mon Health?
When I finished, I wanted to stay in the area. My mom and dad still live here in the area, and I grew up here and wanted to stay close. And they had very good reputation for heart care and things that way. So it just all kind of worked out for the best that way.
Well, of course, today is Valentine's Day. I hope that you've taken care of the significant other. I got to stop and pick up some flowers or something on the way home today, but that's another discussion for another day. So what better day to talk about heart health than Valentine's Day? So can you talk to us about the different numbers patients should know when it comes to heart health?
As far as kind of their general management, there's multiple things that are obviously important. Maintaining adequate blood pressure control, cholesterol control, diabetes control. Those are kind of the big three as far as things in that regard. And blood pressure, recs have actually changed, multiple times over the last, even since I've been, in practice and in medical school, based on, newer studies showing, that lower numbers than initially thought are better, and people do better longer term with better control and even lower control of their blood pressure. And actually, the most recent things showed that actually the goal for most people is actually less than 130 over 90. To be ideally controlled as far as their blood pressures go. And then in regards to cholesterol management, again, patients that have known coronary disease, especially or very high risk or have multiple high-risk features or other vascular disease, their LDL cholesterol goal should actually be less than 70. And actually, in the European models over the last year or two, they've actually gone even lower than that. They've actually tried to have goals of less than 55, which is a lot more capable of achieving now with a lot of the newer medications that we actually have to help treat people in that regard. And again, the studies have shown that again people do better. The lower these numbers, the better. As far as your long-term risk in that regard.
So, why is it important, folks? Why you have an idea of what your blood pressure is, what these numbers are. Why is it important that you know?
Again, it helps not only it helps guide your healthcare providers into kind of managing things. When you come into the office, it's sort of a one-time snapshot of what you're getting, especially with the blood pressures. So if people are able to monitor things at home on a routine basis, you're able to kind of get a better idea of where things are running more consistently. You may somehow have a blood pressure that's adequate when you come into the office on one day, but then you notice over the next 3 months that hey, it's running higher consistently, and it's running to where it probably should be treated either with lifestyle changes or even pharmacologic therapies at that point. And the same thing too goes for the cholesterol and especially the diabetes management. That's a huge one for patients to really kind of pay attention to, and to really take a strong interest in their own management with their sugar control.
I got a little bit of an off-the-wall question here before we hit the break here.
Yeah.
So my handy-dandy Apple Watch that
Yep.
I now wear on my wrist,
Mm-hmm.
I believe it monitors, I know it does heart rate. It might do, I don't know if it does blood pressure or not, but it keeps track of a lot of things.
Right.
Is it accurate? Is that helpful to you, or is that just a gimmick to help sell more Apple Watches?
No, they actually are. They're fairly accurate in regards to, especially the biggest thing that I think that helps is to help diagnose things like atrial fibrillation, where people don't sometimes may not feel it, and especially sometimes even at night during sleep and things that way. But yeah, that's actually, they'd actually done some of the studies, I believe at Stanford, with looking at that. And again, it's not 100%. It's not 100% completely accurate. You do sometimes have some artifactual things, but if you get things that are saying that there's possible atrial fibrillation or other things in that regard, then that's something you obviously want to bring up to your provider, and then they can probably do some further testing and monitoring and things on a more standard basis, so to speak. The other thing too is you can actually, there's other apps with most of the phones now where you can actually even do short little EKG tracings at home just through that, and through finger. There's a digital adapter that you can use for that as well. So,
as they say, there's an app for that.
There is.
We're talking to cardiologist Dr. Richard Smith this morning, Mon Health Heart and Vascular Center. When we come back, we'll talk about the importance of family history and what are the actual symptoms you would experience if you're having a heart attack. We'll discuss that coming up on the other side of the break. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Richard Smith, cardiologist, Mon Health Heart and Vascular Center. And Dr. Smith, what role does a patient's family history play in their heart health?
It can actually play a pretty large role. There's been a lot more work lately in looking at a lot of the genetic aspects of coronary disease, and some of the more recent findings they've seen, especially in sort of European heritage, which is a lot of in our area. There's some genetic linkage, genetic markers that's probably in about that they've noted in about between 20 and 40% of patients that then are a precursor to developing coronary disease more quickly and sometimes even more severely with different things. So there's other things too that are there's actually things like familial hyperlipidemia, which is a familial genetic trait that causes your body to produce an extreme amount of cholesterol, which obviously causes a lot of people in a very young age to develop coronary artery disease and other vascular disease, even into their 20s and 30s. And that's why actually even now a lot of the recommendations, even in some of the pediatric literature, is to really start early with screening kids, even with just initial cholesterol values, and also too with a lot of, again, so many younger people having problems with early type 2 diabetes from obesity and other things in that regard. It's become a much earlier process and a much earlier treatment plans than what it used to be 30, 40 years ago. So if you have if all your close relatives have all had coronary disease, especially early, less than 50 for men or less than 60 for women, or earlier, that you should definitely make sure that you're getting seen by someone to get at least your modifiable risk factors evaluated and treated accordingly.
Talking to Dr. Richard Smith, cardiologist, Mon Health Heart and Vascular Center this morning here on Mon Health Talk. And we've probably all seen on TV or in the movies someone having a heart attack, and it's a very dramatic scene, and that may not always necessarily be in the case. In fact, I've heard stories, anecdotally obviously, people have heart attacks and never knew they were having a heart attack until after the fact when they get to the hospital. So what are some symptoms and signs that you may in fact be having a heart attack?
Yeah, I mean, not everybody has the classic, elephant on the chest, sweaty, arm pain, jaw pain, associated with things that way. And it's funny, being in the radio business and things. That's what happened with John Cougar Mellencamp. He was actually on tour, thought he had the flu, and ended up when he finally went to the hospital, they found he'd had a heart attack and didn't know it. But yeah, you can have multiple different signs or symptoms. Sometimes it's just more acute onset shortness of breath. Sometimes people have more acute upper back or pain between their shoulder blades. Sometimes it's more of a burning type pain. People a lot of times will mistake indigestion for a heart attack. And sometimes people have even more vague pain otherwise too. That's again, everybody's really different, and everybody presents differently. So, especially when you have more of acute onset of some of these symptoms that's especially not going away, those are the times you definitely want to get checked out urgently.
A friend of mine, it's been a couple of years ago now, was sitting at home by himself, had what he described as a twinge in his chest, and thought something's not right. He didn't feel bad. He drove himself to the hospital, walked himself in, and said, something doesn't feel right. Half an hour later, they find out he's got a blockage in the widowmaker, and that he's extremely lucky. So, like you said, it's not always the dramatic, clutch in the chest. This is a reference that's way too old. The Fred Sanford, here I come, Elizabeth.
Yep. No, exactly.
It can be as simple as just a little bit of twinge, and going to get that checked out is not necessarily a bad thing.
Yes, exactly.
Talking to Dr. Richard Smith, cardiologist, Mon Health Heart and Vascular Center. Going to take our final break. We'll come back, talk about some of the procedures offered at the Mon Health Heart and Vascular Center as we continue here on Mon Health Talk on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Richard Smith, cardiologist, Mon Health Heart and Vascular Center. And what are some of the procedures that are offered through the Mon Health Heart and Vascular Center?
I mean, we do all of kind of your basic general and interventional cardiology things, as echocardiograms, stress testing, and then your more invasive workups like cardiac catheterization and angioplasty and stent placements, and then a lot of structural heart procedures in that regard too, like transcatheter valve replacement, mitral clip, and things like Watchman in folks that have atrial fibrillation that can't be on long-term anticoagulation. All those things are offered at Mon Health.
Last week we were talking to Dr. Warden. He joined us here on the program. We talked about how so many of these procedures are becoming less invasive, actually minimally invasive.
Right.
And some of them, you maybe even be able to come in the morning, go home later that night, where 25 years ago you're talking about an inpatient stay. So
Sure.
What are the benefits to these minimally invasive procedures?
I mean, obviously, there's a lot of times there's overall less risk with the procedure itself, and then again, you're having in the case of the transcatheter aortic valve replacements, there's again, like you said, you'd be having an open open sternotomy, so the actual surgical procedure itself is a big risk. Plus, having anesthesia. Plus having then anywhere from a 3 to 5 to 7 day hospital stay afterwards, in comparison to having essentially access obtained similarly to what you have with cardiac catheterization, and having the valve done in that regard, and again potentially going home the same day, or usually at worst the following morning. Without having the rehab afterwards, again from the surgical procedure that would have had to have been done years ago. Also, too, just the ability to treat people that are older or have more severe health problems. Again, people that were older or had other major health problems that precluded them from surgery, then just weren't able to get anything done. And now with these types of procedures, we're able to treat those higher risk patients much better, and they've tend to have done well.
Got about a minute or so here. Where can patients actually come see you? Where are you located?
We're at the 2000 building, right down from the hospital is our clinic, right down from Mon General Hospital, and then we're up on the 3rd floor in that regard. And
website, where can folks find out more information or maybe contact you?
Yeah, it's monhealth.com.
Will patients reach out to you directly, or would it be a referral from their family physician?
Both ways work. A lot of people, I think, do go through their primary care physicians, but self-referrals are also welcome.
And what's the one thing, if folks have listened this morning, what's the one thing you want them to take away from our conversation in about 30 seconds?
Again, be aware of your own health. I think it's very important. And one of the biggest things, again, especially around here, that people can do is if they smoke, to quit smoking. That's the key for more important than any of the other things that probably we do, is to encourage people to quit smoking.
Yeah, we can say this, I think, just about every single week, whatever we're talking about. Diet, exercise, quit smoking.
Yeah.
Those 3 things will help just about everything.
That's very true.
Especially when we're talking about the ticker. Dr. Richard Smith, cardiologist, Mon Health Heart and Vascular Center, thank you for the time this morning, and have a great Monday.
Thank you. You too.
Appreciate it.